High-risk pregnancy care differs from typical pregnancy care in that we're often dealing with the women who have chronic medical conditions coming into their pregnancy, or there have been pregnancy complications recognized as the pregnancy goes forward, or there are concerns with the baby that they're carrying. In addition to women having ongoing chronic medical health issues before they come into a pregnancy or concerns with the pregnancy itself, often women come into a high-risk individual if they're older, maternal age, 35 or older, if they've had their pregnancy conceived through IVF in combination with older maternal age. Those would also be conditions where they might seek high-risk obstetric care for their pregnancy. We would like to see women who have pre-existing medical conditions before they actually consider a pregnancy and are actually pregnant. And certainly there are many medical conditions that if they come in for a preconception consultation, there are alterations to their medical care that we can suggest so that their chronic medical disease, such as their diabetes, can be in the best control possible when they enter a pregnancy, or some of their other medical conditions, or even an inherited metabolic disease can be optimally managed for their best pregnancy outcome before they even enter a pregnancy. We are gaining increasing knowledge that the occurrence of a high-risk pregnancy often signals complications or concerns that are going to be with a woman through the rest of her life. And certainly we recognized for some time that gestational diabetes is one of these concerns, that when women come back into care postpartum, that they need to have this followed up with additional testing, because they're going to be at increased risk for diabetes later in their life. I think we're recognizing also now that preeclampsia and even preterm delivery place a woman at increased risk for cardiovascular disease later in life. And so certainly we also now have a whole program directed towards trying to identify these women and get them back into primary care and back into programs where their cardiovascular risks are being addressed.